Welcome to Flying Samaritans at UCLA. Thank you for taking our crash course training and corresponding crash course quiz. A passing grade is 80%, and you will receive an email from us in the following few days. Please note that since we are processing many emails, if you want to go to your clinic of choice, please take the crash course quiz a few days earlier to allow adequate processing time. Now, if you're a returning member who has already been to clinic and passed the oral exam portion, you're completely done. Please remember that you still need your HIPAA certification and your vaccinations to qualify for clinic. You can send those to our secretary at flyingsams@ucla.secretary@gmail.com. Now, if you're a new member, you will have to take an in-person oral examination. The in-person oral examination takes about 10 minutes and simulates what it is like to triage your patient at clinic. Don't worry, it's quite simple, and the following video will teach you exactly how to do it. Please note that in this video, the student and the patient will be speaking in English. However, at clinic, the patients will be speaking in Spanish. Please remember to look at the patient at all times, even if you are not a translator. All right, with that, let's begin.
Hi, I'm Sarah. Nice to meet you.
Hi, I'm Fernando. Nice to meet you too.
Hi, Fernando. So I'm a student from UCLA. I'm going to be taking your patient history and asking you some questions about your condition. I'm not a medical professional. I'm just going to ask you some questions before the doctor comes in to see you. Were you a patient with us before?
No, it's my first time.
Okay, in that case, if you're comfortable having a student talk to you about your illness, I'm going to have you sign a waiver that says you're comfortable.
All right, awesome. I'll do
All right.
it.
And if you return to our clinic, you won't have to sign this again.
All right, sounds great.
Great. So you saw vitals, right?
Yes, I did.
Okay, great. So I'm going to just ask you some questions about your patient history.
Okay.
Like, do you have any medical conditions?
At the moment, no, I do not.
Okay, no diabetes, hypertension, nothing like that.
Nothing too serious or chronic.
Okay, great. And have you had any surgeries recently?
I did have my tonsils removed a few years back.
Okay, was there any complications?
No.
Okay. And do you have family history of illness?
Yes. There is a history of diabetes and high blood pressure in my family.
Okay. So do you work right now?
No, not right now. I'm just living with my mom.
Okay, and what's your daily routine? What's your primary diet?
I don't really have a daily routine. I just like taking care of the garden at home, where we use some fertilizer and grow some of our own food.
Okay.
Yep.
And do you eat from the garden? Where's your source of water?
Yes, I do. I drink water from the tap, and I eat some vegetables from the local supermarket and our garden. And I have a regular diet of beans and tortillas.
Okay, great. Do you engage in any behavior like smoking or drinking or drugs?
Nothing like that.
And no smoking in the household? No one smokes?
No.
Okay. And do you have your vaccines?
Yes, I do.
All right, great. So what's your primary complaint?
I've been just feeling pain/discomfort in my abdomen, and I've been vomiting and having diarrhea as well.
Okay. When did this start?
About 10 days ago from today, so like early last week.
Okay. And you would say that your stomach is the main place where it hurts. What part of your body hurts?
Yeah, it's like my lower abdomen.
Lower abdomen. Okay. And how long do your symptoms last, or are they constant?
No, it's definitely not constant. It's something that's sort of on and off, but I feel like it's been getting just worse over the last 10 days.
Okay.
Yeah, so I feel worse now than I did 10 days ago when it started.
Okay. How would you describe the pain that you're experiencing?
I don't know. It's actually kind of hard to describe. I would say that the feeling is sort of vague and it's very on and off. And I just feel like I just have a lot of bowel movement and vomiting.
Okay. And what makes it worse? What makes the pain worse?
Nothing really comes to my mind except for I feel a little bit worse when I'm eating stuff.
Okay.
Yeah.
Great. And does anything make it better?
No, not really. I mean, passing of stool and vomiting sort of helps, and so that sort of helps with the pain. but aspirin helps me with the fever.
Okay,
Yeah.
great. And from a scale of 1 to 10, 1 being low pain and 10 being the worst pain you've ever felt, what number would you give your pain?
I would say like a 7. It's
A
pretty up
7.
there.
Okay. And do you have any other complaints for us today?
Yeah, I've been feeling some discomfort in my knees and ankles
Okay.
recently,
And when did this start?
about 20 days ago.
Okay. And how long does the pain last, or is it constant?
No, it's not constant. When I get it, I feel like I just have it for a few minutes until I stop noticing it, and it's been sort of like that on and off for the last 20 days that I had it.
Okay.
Yeah.
So how would you describe it?
I mean, it just aches, and it becomes more stiff, and it feels a lot worse if I start noticing it as well. And there are periodic flare-ups and intense pain.
Okay.
Yeah.
What makes it flare up? What makes it worse?
I feel like cold weather.
Cold weather.
That's why it does it.
Okay. Anything make it better?
Not being in a cold place.
Okay.
Yeah.
Again, on a scale of 1 to 10, 1 being least pain, 10 being most pain, how would you rate your pain?
I would say about an 8.
An 8.
Yeah.
Okay. And just in general, to make sure nothing else is going on, you've been feeling generally okay besides your knee, ankle, and stomach, correct?
I mean, other than the stuff I said, I feel like I'm okay.
Okay, no dizziness, heart palpitations.
No, nothing like that.
Okay, all right. Thank you. Now we'll call in the doctor to see you.
All right, awesome. Thank you. Yeah. Hey, I'm the doctor to which Sarah is going to explain the symptoms of the patient so I can make a proper assessment of the patient's conditions. All right, Sarah, can you tell me about the patient that you just talked to?
So my patient, David, is a 22-year-old male. His primary complaint was gastrointestinal distress. So basically vomiting, diarrhea, and stomach pain with some fevers and inability to sleep. And no unusual things came up in his patient history except that he drinks tap water, which could pose a problem. His secondary complaint was pain in his knees and ankles.
All right, Sarah, so what do you think the patient has?
Well, based on the gastrointestinal symptoms, I might guess food poisoning if he's been eating from the same, say, bag of beans for the whole week.
Food poisoning. Although that is a very good guess, in this case, this is not food poisoning but a roundworm infection, most likely Ascariasis. So in this case, it's not really applicable, but in other cases, such as when we're suspecting a UTI or a pregnancy, we may have to utilize lab tests. Okay. And since this person has a roundworm infection, we're going to have to treat this person with mebendazole, Pyrantel, albendazole. Some herbal remedies could help as well, but these are the very standard things that we were planning to use. And the patient will be able to obtain these from the pharmacy. And to prevent an illness such as this one, transmission of this roundworm is actually from hand-to-mouth contact, not by touch, which means that the food the patient has been eating may have been prepared under unsanitary conditions. So to prevent this, vegetables and all garden products should be thoroughly washed with warm water before eating, and hands should be thoroughly washed as well. Also, the patient should avoid drinking unfiltered water, and if they can't do so, they should boost the immune system.
Great, thanks for the answer, doctor.
Oh, no problem, Sarah.
Thank you for watching our oral examination video. The previous video was a perfect example of how to triage a patient at clinic. During the oral examination, you will not be able to take notes in, nor will you be able to use the list of questions provided online on our triage resources. However, during the examination, you will be provided with a blank patient evaluation form for your convenience. You will also be graded on a rubric scale so that all tests are standardized and fair.